become obscenely rich. But it was only during the last few years of my career that I came to realize the full scope of the harm my colleagues and I had caused, and the lengths that insurance companies will go to increase their profits at the expense of working families. As I told the Senate Commerce Committee 2 months ago, the higher up the corporate ladder I climbed, the more I could see how insurance companies confuse their customers and dump the sick, all so they can satisfy those Wall Street masters. I described for the senators how insurers make promises they have no intention of keeping, how they flout regulations designed to protect consumers, and how they make it nearly impossible to understand or even to obtain information consumers need. I also told the committee how the industry has conducted duplicitous and well-financed PR and lobbying campaigns every time Congress has tried to reform our healthcare system, and how its current behind-the-scenes efforts may well shape reform in a way that benefits Wall Street far more than average Americans. I noted that just as the industry did 15 years ago when it led the effort to kill the Clinton plan, it is using shills and front groups to spread lies and disinformation to scare Americans away from the very reform that would benefit them most. Make no mistake, the industry, despite its public assurances to be good faith partners with the President and Congress, it has been at work for years laying the groundwork for devious and often sinister campaigns to manipulate public opinion. The industry goes to great lengths to keep its involvement in these campaigns hidden from public view. But I know from having served on many trade groups that industry leaders are always full partners in developing strategies to derail any reform that might interfere with their ability to increase their company's profits. My involvement in those activities goes back to the early 90s when insurers joined with other special interests to finance the activities of an organization called the Healthcare Leadership Council, which led a coordinated effort to scare Americans and members of Congress away from the Clinton plan. A few years after that victory, the insurers formed a front group called the Health Benefits Coalition to kill efforts to pass the Patient's Bill of Rights. While it was touted as a broad-based business group, the Health Benefits Coalition in reality got the lion's share of its funding from big insurance. Like most front groups, the Health Benefits Coalition was set up and run out of a big, well-connected PR firm. One of the key strategies developed by the PR firm as the coalition was gearing up for the battle in late 1998 was to stir up support among conservative talk radio hosts and other media. The PR firm formed alliances with groups like the Christian Coalition and the Family Research Council and persuaded them to send letters to Congress and to appear at press conferences. The PR firm also launched an advertising campaign in conservative media outlets,